Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be going over antibiotics. So if you're studying pharmacology, this is a great video for you. We're going to be going over many different medications and different drug classes that fall under the umbrella of antibiotics. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There you can sign up for Next Generation NCLEX Review Part 1 and Part 2. In Part 1, I teach you how to think critically. I teach you about prioritization and delegation. I teach you about different scenarios and phrases that NCLEX may use and where your mind is supposed to go. In Part 2, we go over actual NCLEX type questions and, most important, the rationales, how you should be applying them to your exam questions. If you're a current student and you have to do really well on your next exam, check out the audio lessons that I have available. Also, if you're struggling and you would like that one-on-one tutoring, I provide private tutoring. I book very quickly, but I still provide it. Be sure to check out my website, or maybe you want to pick my brain about something. I also offer consultation sessions. Again, all of these resources can be found on my website, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, Facebook, or right here on YouTube. My handle is the same everywhere, Nexus Nursing. Without any further ado, guys, let's get started. Antibiotics. All right, first question. Your patient is prescribed gentamicin. You'd monitor for which adverse effect? Bradycardia, tinnitus, hypokalemia, hyperglycemia. Your patient's prescribed gentamicin. Which adverse effect would you be monitoring this patient for? Very good, tinnitus. So let's talk about this, guys. Gentamicin, you have to know what class of drug it falls under. It is an aminoglycoside, and something that can help you, the aminoglycosides end in mycin, gentamicin, neomycin, streptomycin, right? You hear mycin, most likely it's aminoglycoside. You have to know the drug class. Now, when we're talking about adverse effect, correct, tinnitus. It can cause damage to the ear, decreased hearing, or they can tinnitus is actually ringing of the ears. So the patient may have ringing of the ears, but these class of drugs can cause ototoxicity, which is damage to the ear. That's what I meant to say, ototoxicity. It can also cause nephrotoxicity, damage to the kidneys. And we're also going to be paying attention to the liver, because any drugs, it doesn't matter, it doesn't have to be antibiotics, any drugs that you take, the liver has to metabolize that drug. And so you always have to pay attention to liver function as well. But specifically, when we are talking about aminoglycosides, you are always going to be very concerned about ototoxicity and nephrotoxicity. Those two are the biggest ones, okay? Next question. So the same patient that's taking aminoglycoside, their creatinine clearance is decreased. Which of the following actions is most important to take? You're going to increase the dosage of the aminoglycoside. You're going to notify the healthcare provider. You're going to administer the drug more frequently, or you're going to discontinue the medication immediately. The patient taking an aminoglycoside has a decreased creatinine clearance. What are you going to do? Very good. Notify the healthcare provider. Now, I saw 37 of you guys chose discontinue the med immediately. So let's talk about the right answer. Then I'll go to the wrong answer choices. The right answer, you're going to notify the healthcare provider, because I just told you when it comes to aminoglycoside, the two biggest concerns, you're going to be concerned about ototoxicity, their hearing, and you're going to be concerned about nephrotoxicity, the kidneys, right? So The fact that we know we're going to be concerned about these two things, and then you look at creatinine clearance and it's gone down, what do we suspect is happening? Nephrotoxicity. You better notify the healthcare provider. You expect something to change. Maybe the dosage is going to be changed. And when I say change, I mean decreased, because that's not something you as the nurse is going to do. That's not within your scope of practice. The healthcare provider is going to do that. You expect either that to change. Maybe you expect the drug to be changed. You don't know, but you expect something to change because the kidney's being injured, right? So you're going to notify the healthcare provider. Now let's look at the wrong answer choices. The first one says to increase the dose of aminoglycosides. Two people chose that. You cannot increase or decrease the dose of anything. You have an order, a prescription, right? You either give that medication or you withhold it. And, that's another story for another day when you withhold medications. But, if you see adverse effects, you withhold medication, but you cannot change the dosage. You'll be stepping out of your scope of practice. So that cannot be right. That can never be the answer. Next, administer the medication more frequently. You cannot change the frequency of a medication. You have an order, you have a prescription. The prescription is going to have the dosage, it's going to have the frequency, it's going to have the route. You cannot change that. You would be stepping out of your scope of practice. Now, what you can do is withhold a medication and notify the healthcare provider on the reason why and get orders, blah, blah, blah. But you can't change that frequency. So that is never going to be the correct answer. And last, discontinue the medication immediately. There is a difference between discontinuing and holding a med. As a nurse, you can hold a med. You can have an order to give a med, and you find for whatever reason this drug has contraindications. You can withhold the med and notify the healthcare provider, but you don't have the authority to discontinue a med. That is outside your scope of practice. So the only thing you can do here is notify the healthcare provider, guys. This is very important information you need to know for pharmacology. Don't say I didn't warn you. Your patient is prescribed meropenem. Which of the following adverse effects would you monitor for during this therapy? Would it be hyperkalemia? Would it be pseudomembranous colitis? Would it be hypoglycemia? Or would it be hypotension? Your patient's prescribed meropenem. Which adverse effects are you going to be looking out for? Wow, most of you guys chose hypotension. No, the correct answer is pseudomembranous colitis. So first of all, let's talk about this drug, meropenem. This is carbapenem, and a way to remember most of these drugs end in enum, like meropenem. It's a carbapenem, okay? So pseudomembranous colitis, pseudo, whenever you see that word pseudo, that means fake, right? Fake, fake colitis of those membranes. I'm saying membranes, that's not the word I'm looking for. Well, yeah, you do have membranes. You have oral membranes, you have intestinal membranes. So yes, that's actually the word I'm looking for. So it's a fake colitis of the intestinal membrane, but it's not real. It's fake. It just mimics it, right? So the patient will have, the diarrhea, abdominal pain, fever, but it's not true colitis. But those are true adverse effects, right? If we see the patient has this, we're going to withhold that medication, notify the healthcare provider. We're not going to give the next dose. That is an adverse effect. There is a difference between side effect and adverse effect. Many times we use it interchangeably, but they are not the same. Side effects are things that may possibly happen. You warn the patient it can possibly happen so they don't stop taking the drug, but it doesn't really mean we're going to do anything to change it. We kind of expect it to happen, right? Adverse effects are things that may possibly happen, but we do not want to happen. So we tell the patient, if it does happen, you need to let us know right away so we can notify the healthcare provider. We expect some type of orders to be written. So anyway, we're talking about meropenem, which is, again, a carbapenem. You do have to know that drug class. And one of the adverse effects is pseudomembranous colitis, fever, abdominal pain, diarrhea, severe nausea and vomiting. You guys have to know the the drugs that fall under this class. And let me explain to you why this patient may have this adverse effect. So what happens is, guys, this drug, it basically messes with the intestinal normal flora, right? It decreases the normal flora that you'd have in your gut, and it can cause the patient to have C. diff. Well, guess what? That increases the risk of that patient getting pseudomembranous colitis. So we're going to be watching out for that when it comes to um, all the drugs that fall under carbapenems, okay? How are you guys doing on the live? All right. So the same patient, that patient that has took a carbapenem, they have a medical history of seizure disorder. What action would you take? So you looked in that patient's medical chart and you see they have a history of seizure disorder. What are you going to do? Are you going to increase the patient's dose of the carbapenem to enhance effectiveness? Are you going to monitor the patient for signs of seizures during treatment? Are you going to discontinue the carbapenem and request a different class of antibiotics? Or are you going to give that drug with the anti-seizure medication? What are you going to do? Most of you guys chose the correct answer. Good. You're going to monitor for signs of seizures during this treatment. Why? I already explained to you. You can't change the dosage that the patient's getting. You cannot discontinue the drug that the patient's getting. So those two would automatically be out. And last, administer the carbapenem with the anti-seizure medication. No. And here's why. This drug, drugs that fall under the carbapenem drug class, they decrease the thresholds for seizure activity. That means the patient is at higher risk to have a seizure. So if they're on this drug and they have a history of seizure disorder, what are we going to do? We're going to have to be monitoring this patient for seizure activity. That patient's going to be on seizure precautions. Bed's going to be in the lowest position. Side rails are going to be padded. Patient's going to have decreased stimuli. You're not going to have the TV on, the radio on. The patient's not going to be next to the nurse's station where everybody's talking and there's all this activity. We're trying to what? Decrease activity. The lights are going to be dim, right? No bright lights. We're trying to decrease activity. Patient's going to be on seizure precautions. Select all that applies. Your patient is prescribed ciprofloxacin. Which of the following instructions would you include? Select all that apply. Here are your options. Take the medication with a full glass of water. Avoid taking the medication with dairy products. Limit sun exposure and wear sunscreen. Expect mild joint pain or swelling. Take this medication with food. Take this medication on an empty stomach. What are you going to teach a patient regarding ciprofloxacin? All right, let's talk about this. So the drug is ciprofloxacin. This is a fluoroquinolone. Okay, you do need to know the drugs that fall under the fluoroquinolone drug class, and the way you remember, most of them end in sin. So you have ciprofloxacin, deflufloxacin, levofloxacin. It ends in that sin, right? But you got to know the drug class, which is fluoroquinolone. What are you going to teach? Take the medication with a full glass of water. Why? We want to flush the kidneys. We want to flush the kidneys and decrease crystal formation. Remember, your kidneys are responsible for excreting the drug. Just like your liver is responsible for metabolizing the drug, well, that drug's broken down. Your body's got to get rid of it. Who gets rid of it? The kidneys, right? We want to flush the kidneys. We don't want to make the kidneys work any harder than they're already working. Take a full glass of water. Avoid taking the medication with dairy products. Why? Dairy products decreases absorption of the drugs. Limit sun exposure and wear sunscreen. Why? You need to know with this class of drugs, it can cause photosensitivity. So you're going to teach a patient to wear sunscreen, wear a large brimmed hat, make sure they're covering their skin. Take with food. Why? It will decrease GI upset, right? And you're going to teach a patient about having small but frequent meals. That also helps with decreasing the GI upset. Now, the two that we did not choose, I'm going to explain you why. Explain you. That's not good English. I'm going to explain to you why. Expect mild joint pain or swelling. Absolutely not. Something else you need to know about fluoroquinolones, an adverse effect is tendon rupture and tendonitis. That is a medical emergency. So you have to teach that patient, if you start feeling any type of joint pain, swelling, a muscle pain, you need to report it immediately, right? It may be a symptom of, again, tendonitis or rupture of the tendons. Next, taking on an empty stomach. No, that's actually going to cause more GI issues. We want to decrease the GI issues. Okay, make sure you know your fluoroquinolones. Select all that apply. The same patient, so the same patient taking a fluoroquinolone is assessed for which possible adverse effect? Tendonitis, peripheral neuropathy, hypoglycemia, prolonged QT interval, renal toxicity, hepatotoxicity. Your patient that has been prescribed a fluoroquinolone, what would you be assessing them for? What adverse effects would we be concerned about and we would be assessing them for? Tendonitis, peripheral neuropathy, hypoglycemia, prolonged QT interval, renal toxicity, hepatotoxicity. By the way, guys, this is a famous NCLEX question, not this exact question, because you guys know I have character limitations on Kahoot, but just the subject matter, knowing these adverse effects, you have to know them. Usually you'll see it in a case study or a select all that applies. All right, let's talk about it. Tendonitis. Everyone should have gotten that. I just talked to you guys about tendonitis. Peripheral neuropathy. Absolutely. Prolonged QT interval. Yup. To the point that before the patient even goes on this med, an ECG is going to be done. All right. There are serious risks for cardiac dysrhythmias. Renal toxicity, you're going to be looking at that urine output. You're going to be looking at that GFR. You're going to be looking at that BUN and creatinine. And of course, hepatotoxicity, you're going to be looking at those liver enzymes, right? No on hypoglycemia. Hypoglycemia was the only one that's not an adverse effects, but all of the others are adverse effects, and you do need to know that regarding fluoroquinolones. Select all that applies. So your patient is prescribed, I'm not even going to try to pronounce this drug, Bactrim. I'll call it by its trade name, Bactrim. What patient teaching are you going to provide regarding this drug? Here are your options. Drink at least 8 glasses of water daily. Avoid prolonged sun exposure and wear sunscreen. Eat small, frequent meals. Discontinue the medication if a rash develops. Inspect mucous membranes for redness or inflammation. Take the drug 1 hour or 2 hours after meals. Now, remember, this is what you're teaching to the patient. This isn't something you're doing. You're teaching it to the patient. I should have worded better. I'll just tell you, go ahead and choose discontinue the medication if rash develops, because that'll throw you off. But I'll tell you why. I'll explain in a minute. I should just let you guys guess, actually. Okay. I knew that was going to happen. Let's talk about it. Drink at least 8 glasses of water per day. Yes, you want to flush out the kidneys. Great. Avoid prolonged sun exposure. Yes, because of photosensitivity. Eat small, frequent meals. Yes, because of GI upset. Discontinue the medication if rash develops. Yes. I did not have enough characters. I should have added though. Discontinue if rash develops and notify the healthcare provider immediately. Let me tell you something. When it comes to this drug, guys, this Bactrim, this medication, this is a sulfonamide, and one of the adverse reaction is Steven-Johnson syndrome. This is a lethal, a deadly skin disorder. We don't play with that. You tell the patient you get a rash, stop taking the drug. Stop taking it immediately and notify your healthcare provider. You have to come in. We have to assess you. We have to make sure that what's happening is not Steven-Johnson syndrome. When it comes to sulfonamides, again, this type of drug is a sulfonamide. You do need to know the drug class. One of the biggest red flags when it comes to this drug class is Steven-Johnson syndrome. It's deadly. It's potentially lethal, okay? So yes on that. Inspect the mucous membranes for redness, inflammation. Yes. Why? One of the other adverse effects is stomatitis and mucositis, right? So true. And take the drug 1 hour before, 2 hours after meals. Yes. Why? We want to increase absorption of the drug. We don't want to, this type of drug, you don't take it with meals. An hour before or 2 hours after. When it comes to the sulfonamide class, also something important, the patient cannot take this drug if they are allergic to any sulfa drugs and also thiazide diuretics. You guys need to know that. What else is a famous test question about this drug? I can't think of anything right now, but you got to know the drugs that fall under the drug class of sulfonamides, right? They end in zine, like sulfonylurea. So you see that most likely it is a sulfonamide. I feel like there's something else. There's another famous question they ask about this, and it's not coming to me. Oh, I know. When it comes to sulfonamides also, um, if the patients are diabetic and they're also taking oral anti-diabetic agents, there is a very, very high risk that it can cause the patient to be hypoglycemic. That's a problem. What kills you faster, hyperglycemia or hypoglycemia? Hypoglycemia every day of the week, and it kills you much faster than hyperglycemia ever could. So that's something else you got to be concerned about. Make sure if you see this medication, make sure you look in that patient's chart. Look at the diagnosis. Is that patient diabetic? Look at the drugs they're on. Are they taking the oral anti-hypoglycemic agent? Okay. Select all that applies. Your patient is prescribed a penicillin. You're going to prioritize monitoring for which adverse effects. So we're talking about penicillin, which adverse effects? Here are your options: rash, fever, wheezing, sore mouth, furry tongue, stomatitis. The patient that is prescribed a penicillin, what are the adverse effects we would be watching out for? Select all that apply. All of them. All of these are adverse effects. You're going to be watching out for all of them. What causes the furry tongue? Okay. So the normal flora in your mouth is decreased when you take this medication. So it allows like bacteria and fungus to grow, and that causes that furry tongue. Yeah. So you'd be watching out for all of these adverse reactions. Okay. False. Tetracyclines are teratogenic. Is that true or is that false? Tetracyclines are teratogenic. True or false? True. Tetracyclines are teratogenic. What is teratogenic? That means it causes birth defects. So someone who is pregnant, someone who is breastfeeding cannot be prescribed a tetracycline. And if they are you going to be a robot and just give it to the patient because it was ordered? Absolutely not. You're going to withhold that drug and call that healthcare provider and say, hey, did you check that HCG? Right? Or she's breastfeeding because it transfers through, excuse me, the breast milk. Okay. You do have to know the drugs that fall under that drug class of tetracyclines, and that's easy because they end in "ene." Tetracycline, doxycycline, minocycline. They end in cycline, so you'll know it's a tetracycline. True or false? Tetracyclines should not be given to children older than 8 years of age. Is this true or is this false? Tetracyclines should not be given to children older than 8 years of age. True or false? Oh, I got so many of you guys. False. False. So many of you guys said true. Guys, tell me what's the one word in this question that made you know it was false? What's the one word? I'm waiting. Older. Yes. Older? No. Tetracycline should not be given to children younger than 8 years of age. Why? It damages the developing bone and teeth. The minute you saw older, you should have known it was wrong. Be careful not to read too fast. Younger. You don't give it to children younger than 8 years old, not older than 8 years old. And you need to know why. Okay, it affects the developing bone and teeth. Last question, true or false? Digoxin toxicity rises when tetracyclines are taken concurrently. Is this true or is this false? Digoxin toxicity rises when tetracyclines are taken concurrently. True or false? True. So if this person is on a tetracycline, but they are also taking digoxin, you better be checking the dig levels, okay? So you better know what your normal dig levels are, right? 0.5 to 2. So you're going to be looking at that and you're going to be assessing your patient for signs of dig toxicity because we know they have a higher risk of going into dig toxicity. So you're going to be watching out for, nausea, vomiting, bradycardia, visual disturbances like blurred vision or seeing like green or yellow halos, confusion, dizziness. You need to know those signs and symptoms of dig toxicity. You need to know the normal dig levels, and you absolutely need to know. Wait, I said that already. I feel like there was a third thing I want to tell you about dig and tetracyclines. Maybe not. Know those two things at least, though. I feel like there was a third. The level, the signs and symptoms of dig toxicity. Huh. All right. I can't think of it. Anyway, that's the end of it. That's the end of this video, guys. Let me know what you thought. If you'd like to see more Kahoots on pharmacology, let me know what types of drugs you'd like to see me cover, and I have no problem. I'll make the video for you. Let's see how you guys did.